Oh,
Okay.
definitely let me know. I'll take you out for lunch.
Awesome, awesome. Hello, everyone. Welcome again to Conversations like this, where we help you live long and well. I'm Dr. Livingston. I'm your host, and I'm excited today to have yet another conversation on how we help improve our quality of life because how well we live is just as important as how long we live. I this has been it's been in the works. What now? 6 months, Dr.
Quite a
Tracy.
while. Yes, quite a while we've been trying to get together.
So we've been trying to have this conversation, and we're talking about how women can stay strong and healthy in midlife. If you're a man watching this, don't be jealous. If there's a wife or a woman you can share this with them. You can take notes and then forward. So there's a lot to unpack today in this conversation. Of course, if you're listening live, you give us a shout out so we can celebrate you. And of course, in replay as well, let us know. But I'm honored and delighted to have Dr. Traci DeSplinter. She is a board certified OB/GYN physician. She has over 2 decades of experience, and her practice is in Houston, Texas, where she specializes in helping midlife women in their health, helping them to optimize it, and also helping them to thrive and feel overall well from perimenopause through the menopause transition and beyond. She is also she's also an expert in medical weight loss. Dr. DeSplinter, thank you for coming. I celebrate you and I thank you for the gift that you are to your world. How are you doing?
I'm doing great. Thank you so much for having me. Like you said, it's been a long time coming, and I'm just excited to have this chat with you.
All right, awesome. Now, and we're going to share a few fun facts about you. Now, share the one that amused me the most when we had the conference we were at together. She's an avid scuba diver. Oof, oof.
Yes, yes, I am. I'm actually kind of obsessed with it. It's my hobby, but it's also my zen. It's very almost meditative for me. Just puts your mind, you focus, but tune out everything else. So it's just a great hobby that I thoroughly enjoy.
Yeah, you must be very brave because you stay underwater for a long time.
Dives are up to an hour. But for me, it's not scary. It's really, really fun, and it's actually extremely relaxing.
Okay. I'm going to ask you off screen, like the mindset that it took for you to be comfortable with that, because I like the idea of it, but to stay underwater for that long, like, I
You
don't
know,
know.
but in order to become certified, you do learn a lot of the science behind breathing compressed air and buoyancy and all the science. So it's very intellectually stimulating and gratifying. And then by the time you learn that classroom work and you're ready to do your coursework that's in the water, it's not scary. I mean, we have a
Okay.
healthy respect for what can happen, of course, but it doesn't feel scary the whole time you're there.
Thank you. I'm opening my mind to the idea. So thank you for
Okay, good.
sharing.
I'm going to
Let's
make
focus on what let's focus on what we're here to talk about, midlife wellness. So midlife, what does midlife wellness really mean for our viewers who are listening or watching?
So the
Who
term
gets
wellness is a little bit problematic. It's kind of been hijacked, and there's a lot of influencers and grifters who use the term. But what wellness means to me, like from a medical perspective, and also from just being a midlife woman myself,
it?
is just the concept of feeling as well as we possibly can now, and then seizing the opportunity at this critical window of time to protect our future health and to kind of change the trajectory with which we are approaching chronic disease.
I like that. Feeling as well as I possibly can. I like that. And now, I like that. I like that. Now, why is it when people get to midlife, there's a little shift? Sometimes in conversations, it's like, I don't know what's happening to me. They feel like they're broken, or they feel like they don't have as much energy, or they feel like the things they used to enjoy doing easily is a struggle, or they're like, oh, doc, I'm getting old. Is this what aging is? Why does health typically feel a little different, maybe 40s and now?
Oh, Dr. Oliventon, this is a complex question. I don't feel like myself is it's a real thing. It's not that you're going crazy or losing your mind or that you're a hypochondriac or whatever label might be placed. There are kind of a whole host of different reasons that we feel different and fatigued and not as well. Some of it stems from hormonal changes that start in perimenopause, and these changes start to happen even before there's a change in the periods. Some of it is that the social aspects. So women in their 40s a lot of times are at the peak of their, or approaching the peaks of their careers. They're super busy at work. A lot of times they have young children. They may also have aging parents. So there's a lot of demands. A big thing that happens also at this time is a change in the quantity and quality of your sleep. And that can definitely make you feel not as well as you used to feel, or make you feel not like yourself.
Mm. Wow, you touched on a lot of things. But in this season, for someone who is watching, who's like, so am I? And they're like, are they doomed because they're the sandwich generation, so they're taking care of the parent and the child, and then their hormones are changing too. Is there? I guess maybe the doomed is too strong a word, but is there hope? Are there things to do to help you feel better? Because the idea that this is the new normal is a little daunting and scary. So for that woman,
Absolutely. Yes, they're
yeah,
not doomed, and there is definitely hope. So it's a window of opportunity to evaluate what's going on now to make you not feel like yourself, and what changes are happening, like with lifestyle and with laboratory markers and with lots of different aspects of health, to take the moment, seize the moment to improve these quality of life factors and health factors, so that you age in a more healthy way and that you can feel like yourself again.
okay. And for the person who's listening, who's saying, it sounds like more work. You already said I'm busy. We already had that conversation. I'm busy, the things to do. It sounds like now I got to take out even more time to do the things, Doc. So for that person listening who's like, I don't know, it sounds like you're giving me more homework, Doc. What would you say to that person?
So, time is a finite resource, and I think, especially as doctors, we understand this and we sympathize. Um, we're not asking for all of your time. We're kind of asking for you to put your own oxygen mask on first, prioritize your health, so that you're doing the things you can to feel better and have more energy, so that you can meet all those other obligations. But you can't ignore yourself.
Wow, time is a fine. I think we forget that time is a finite resource. You got to spend it.
Yes. Yes.
Spend it well. Okay. So, based on what you said, what health screenings would you say become more important in this season? Of course, these are general suggestions. We do recommend that people go listen or meet with their own clinicians to take care of them and find out a customized plan for them. But what would you say? What health screenings would you deem more important in this season?
So in this season, starting in the 40s, it's, of course, you want to have your routine cancer screenings, like your PAP, your mammogram, your colonoscopy, starting at age 45 for average risk women. But it's also important to know your biomarker numbers. So like a lot of times during perimenopause and in early menopause, the cholesterol gets way out of whack. Your glucose metabolism may change. So knowing your LDL-C, your hemoglobin A1C, and fasting glucose. And then you also want screening once in your lifetime for something called lipoprotein little a, that is a lipid carrying molecule in the bloodstream that's genetically inherited. You either have it or you don't. And if you have it, it's an independent risk factor for cardiovascular disease. So these are just some things to consider in your 40s and 50s. If you aren't watching these things annually, not the LP little a, but the other things you want to watch annually, because sometimes during this time of hormonal change, metabolic changes happen as well.
Okay. And then what are things that, because you mentioned some of the things that, related to the heart. How can women protect their heart health, with the risk factors going up?
This is a big one. This is a must for all of us, because cardiovascular disease is the number one killer of women in the United States and around the world. Every year, cardiovascular disease takes the lives of more women than all the cancers combined. So while we worry about breast cancer and it is a daunting disease that we need to be diligent with screening, we need to really focus more on awareness of the cardiovascular risk. So there are lots of things, like there are lifestyle factors such as getting adequate sleep and good quality sleep, healthy nutrition, exercise, building muscle. It's important to know your family history, know those lab markers that we talked about for yourself. Also important for women to factor in the obstetrical history. So pregnancy is like a stress test for the cardiovascular system. And if you developed preeclampsia, gestational diabetes, pregnancy losses that were late in pregnancy, these are red flags or risk modifying, risk enhancing factors that can pop up later as additional risk factors for cardiovascular disease. And then, of course, we want to make sure that we're not smoking and avoiding excessive alcohol. So lifestyle factors as well as medical screenings.
Okay. So also avoid toxins. So avoid
Yes.
smoking.
Yes.
Whew. So we have a little bit of a conundrum. The need to eat better, but yet some of the changes in hormones affect cravings.
Absolutely. So in my obesity medicine training, the board certification process for that, I was really surprised at just how complex the interplay of hormones that your gut makes interact with centers in your brain, and not only affect your appetite, but can actually even guide the things you crave. So the really high caloric, high density, high calorie foods, salty snacks and sweets. This is all hormonally driven, and it's complex. It's not as simple as we were taught in medical school: calories in, calories out. It's way more complex than that.
So how do we, knowing that, like, for someone who's like, are you saying that I got to give up the things that I feel add to my quality of life? Doc, the sweets, the high corn fructose syrup that hits the spot, the bread, a little, a few cups of wine at nighttime, and these are supposed to be self-care. How do you advise for someone who feels like you're trying to yank their joy and
So we
they're not.
definitely don't want to yank anyone's joy, but I would ask them to look at the big picture and what are the things that they want to be able to do in their 70s, 80s, 90s, and what do they need to do now to preserve their health to get there. So, for example, like for sweets, we don't want to take that completely away, but maybe make it a small portion on an occasional basis instead of multiple sugary drinks throughout every day.
I like that. And one of the things I also tell people, I said, just test it out and see the trade-off. Less hot flashes, you actually feel better. Put some ice in the glass, it makes it look bigger too.
Yes,
Um,
that's a great piece of advice.
all right. And for those of you who are listening or watching, if you have questions, please feel free to drop them in the comments. I know Dr. Traci will be gracious enough to answer them while we're on live as well. Okay. Doc, you mentioned muscle. Sometimes I feel like people too the hear muscle because, like, no, I'm a woman. I don't want to be muscle. I don't want to look like a man. I don't want to bulk. So why is muscle so important in midlife?
So muscle is important for a whole multitude of reasons. It isn't tissue that just sits on your bones and causes your joints to move. I mean, that's the bare minimum. It's actually a metabolic organ. Skeletal muscle affects your glucose metabolism, helps you to avoid insulin resistance and type 2 diabetes. It helps, building muscle helps to protect your bones. So it helps reduce the risk of osteoporosis, which can lead to fractures and chronic pain. It also helps you to maintain good balance and to maintain independence longer in life.
So there you have it. So can someone negotiate muscle building? Like
Can someone what? I'm sorry?
like negotiate. Like how do
Negotiate.
you encourage your clients to build their muscle in a way that is, not a lot of work? Doc?
It is a lot of work, but I try to meet my patients where they are. So if
Okay.
someone is doing nothing, then I might suggest that she start just some minimal activity, like aerobic activity, like taking a walk after dinner. Just start something small. And then for muscle building, maybe start some lunges or some body weight where you're not lifting anything extra, some body weight exercises, just a few push-ups, some sit-ups, some lunges, some squats. Just start gradually. Whereas if I have, like this morning, I saw a patient who her work is as a fitness trainer, and her muscle readings on the body composition analysis were just off the chart. She was like in the 99th percentile for her gender and age. So talking to her about muscle building is going to be a completely different conversation. So I think the first thing we have to do is talk to patients about why it matters, what their goals are, and then what they're doing now, and see what kind of small steps can we ask them to take to make gradual improvements.
Okay, thank you. That's true. Perspective. You meet people where they are, and it depends on their baseline. We have
Yes.
a question here, and thank you for asking at ATAPYBT 2021. Is there a safe test to determine optimal muscle mass or even bone mass?
Yes, two different tests. So there's a bone density scan, which is the gold standard for measuring your bone density. It is not an expensive test, relatively speaking. So insurance, for average risk people, insurance typically doesn't cover bone density screening until age 65. But I think it makes sense to do it a lot earlier, like a baseline at perimenopause, or certainly around the time of menopause, because a significant number of women already have osteoporosis at that time, and a really high number have osteopenia, the precursor to osteoporosis. As far as measuring your skeletal muscle mass, the gold standard is MRI, but that's cost prohibitive and out of the reach of most of us normal people. So, and the next test would be a DEXA scan, or if you don't have access to a DEXA scan, or it seems a bit difficult to obtain or expensive, then the next best would be a bioimpedance analysis test, and this is affordable, and the professional grade bioimpedance analyzers are within a small percentage of the DEXA scan as far as accuracy goes. So like a 3 to 5% variation there. So bioimpedance would be probably the way to go if you can't get a DEXA scan. Then you want to know your skeletal muscle mass.
All right, awesome. Thank you so much for answering those questions, and very good question for asking. So as we wrap up, what's one myth about aging you wish women would let go of?
The feeling that the myth is that sometimes women feel like just feeling terrible or not feeling like yourself is inevitable and is just part of getting old. So if you have poor sleep, brain fog, low sex drive, just feeling overall low and terrible, these things are treatable. It's not inevitable. You don't have to feel bad.
Okay, and I think also what helps too, Doc, is looking at the cost of the quality of life. Like, what's the cost? Like, what is it costing you, relationship wise, dreams wise, goals wise, like all the things? Like, what is it costing you? Sometimes I find that when patients or clients can articulate what is preventing them from doing that they really want to do, then they see like, okay, it's really important to speak up and ask for help. Just like it's natural to have a baby without epidural,
Ugh.
and we don't have to do that anymore.
Natural and desirable are two different things, aren't they?
Yes.
And I
Thankfully,
support women who want to go without an epidural,
yes.
but I tell them, I'll support whatever you desire, but I'll never understand why. Ouch.
So we're thankful for the gift of medicine and science and the quality of life that it affords us now. So please have conversations with your physician. Find someone like Dr. Traci that you can talk to, and find out the cost of the decisions to stay where you are and not work on feeling better in a way that helps your world. All right, Doc, we're wrapping up. Last question: if a woman wants to thrive not just survive in midlife? What are her first three action steps? Now, that's generally speaking, of course. So, what would you say? So we reduce the okay. We got to do this. We got to do that. But what would you say are the top three, first three action steps, Doc?
So first of all, I would say prioritize self-care, sleep, exercise, nutrition. That's the put your own oxygen mask on first. You can't be your best for other people and meet all the obligations that we set on ourselves until you take care of yourself. So prioritize self-care. Secondly, find a doctor who's knowledgeable about midlife women's health and has time for you and is willing to explore personalizing a plan for you. And then know your numbers and act on them. And you're going to need the guidance of a knowledgeable professional to help you with that, to order those tests, help interpret them, and watch you over time as you improve.
Awesome. I like that, Doc. You did it. You, bam, bam, bam. All right. Doc, where can people find you? Love the knowledge drop today. Love the feedback on tests to do, baseline. Love the actionable steps and meeting patients where they are. For those who want to connect with you, hear more from you, and follow your content. She has good content, by the way. And where
Thank
can
you.
people find you? Where can people find you?
So if they want to find me for medical care, I serve the women of Texas, midlife women throughout the state, both telemedicine and in-person appointments. My office is in the Houston, Texas area. On social media, my Facebook is Traci DeSplinter MD, and my Instagram is also the same, Traci DeSplinter MD. So I would welcome all midlife women who want to follow, or anybody who has a midlife woman in their life that they care about. Follow me.
I like that. She has a lot of content. But Doc, you didn't give us details about your office in
Yes, so
Houston.
I'm in the Houston, Texas area. And like I said, I offer virtual care as well as in-person care. It's full scope gynecology. I don't deliver babies in my current practice, but I do offer gynecologic care. I'm certified by the Menopause Society, and I'm also board certified in obesity medicine. So I can help with weight loss, improving metabolic health, all of the things that affect perimenopausal and menopausal women. I wanted to try to educate myself and increase the depth of my knowledge to be able to address the woman in a comprehensive way.
All right. I will put her website. I was trying to get her to say it. www.refinedwomenshealth.com.
Yes, my
Bam.
practice is Refined Women's Health. I should have said that. Thank you for helping.
No worries, we got you. So we put it in the comments, and it's also for those of you listening on the podcast. It's also going to be in the show notes. We got to highlight physicians, clinicians who are making waves and helping people improve their quality of life one client at a time. Dr. Traci, I celebrate the gift you are. Thank you for what you do, and yes, yes, more grace to you.
Dr. Solo, thank you so much for having me.
My pleasure. My pleasure. So those of you who are listening, those of you who are listening in replay, please celebrate Dr. Traci. Appreciate her for the gift of her time this afternoon. Share with women in your life. And as always, I'm asking a favor. Please like, subscribe, follow, and share. We could all use a little bit more encouragement in this season. And as always, if you or anyone you know is looking for an awesome, a thorough, and compassionate family physician, that will have conversations like this to help you live long and well. You know it. I'm she. Have a good one. God bless you all. And take care of yourself, okay? Self care, she said. We got to prioritize. All right, everyone. Have a good one. Doc, thank you so much. This was